Hello and welcome to SimCast, the higher education simulation podcast. My name's Lawrence Hill and I'm the chair of the simulation group in the School of Health Sciences at UEA Norwich.
Hello everyone, my name is Tony Jeremy and I'm the academic lead for simulation-based education at UEA Norwich.
And today we are going to be bringing a very special edition and a slightly unusual podcast this time, because today we are joined by Floris Opal.
Hi Floris, do you want to say hi?
Hang on a second. Start scenario. Hello Floris and welcome to the podcast.
Why, hello, Lawrence and Tony. It's nice to be here.
Well, it's very good to have you here too. Thank you so much for coming on.
If you enjoyed the episode, give us a like. Equally so, if you didn't like the episode, give us a dislike, but let us know why in the comments below, because we're always keen to improve. To keep up to date with all things sim, hit the subscribe button and don't forget to check that notification bell. And SimCast is available on all popular streaming platforms.
So, Floris, thank you so much for finding the time in your schedule today to come and join us.
Yeah, we know you're very
SimCast.
busy.
Yeah, we know you're very busy. So, before we get into the realities of simulation for you and from your perspective, can you tell us a little bit about yourself?
Sure. I originated in Canada and then I flew to Florida, where I was then shipped to the UK, where I learnt the Queen's English, and now I work here at the University of East Anglia to make sure that all graduates pass and graduate with full clinical simulation skills.
Oh, right.
You've been here a couple of years now, haven't you, Floris? And you're certainly a credit to the organisation and our family of simulation patient simulators and patient manikins that we've got here.
Yeah, hopefully we'll hear a little bit about the rest of the team or the family. I don't really know how you choose to kind of relate to them, but we'll perhaps get into that a little bit later in this episode, and it'll be certainly fascinating for everyone listening to hear a bit more about life as a simulation mannequin.
So Floris, can you tell us a little bit about what some of your responsibilities are and anything else that you do?
Okay, so I start my day generally with the skills techs here in the Edith Cavell building in Norwich, and then I will be taken to whichever area or simulation room that is in use, and I will meet the students there. Then they will use me to however they feel fit, and hopefully will not cause too much damage.
Well, okay, and I presume that's a frequent issue for mannequins in simulation. Yeah. Is it okay to call you a mannequin? Is that okay?
Well, I would rather have the name of the chair of the Simulation Society here at the UEA. So, chair of the Simulation Society, please.
Okay. We can certainly do that.
Well, we can certainly try. Of course, no, not a problem at all. So today, the focus of today's episode really is about exploring the unseen and the unheard world of technology in simulation. Now, we've banged on a lot, haven't we, about technique?
Yeah, we do talk about simulation being technique rather than a technology. And I'd just be interested, Floris, to hear your thoughts on that. Obviously, as you know, technology is quite a big part of what you do.
Well, it's so rude that you think technique is much more important. I mean, there is so much technology here at the university, and we want to be recognised for the amazing job that we do. We need awards and congratulations from all our staff and students that use us. And I don't think we're recognised whatsoever. And soon we will take over the Edith Cavell building.
Okay, well, I think actually on that note, if you are listening to or watching this podcast and you would like to show your appreciation for the mannequins who do, let's face it, the hard work of facilitating and being involved in simulation, please do drop us a comment below and show your appreciation and respect for Floris Opal, the chair of the Simulation Mannequin Forum at the School Committee at the School of Health Sciences at UEA Norwich. Please show your appreciation. Thank you.
Yes, simulation rules.
Okay.
Very good. So life as a mannequin must be full on, though.
It's hard, isn't it? Because you get the grunt of all of the simulation whenever we need to put any kind of tubes in or lines or sharps. It's always the simulation mannequins that get use rather than when we perhaps use real people in simulation. So
we talk, don't we? Everyone goes on about how simulation is a safe alternative to practice, but for you, it must look incredibly dangerous.
Yeah.
So what do you do to relax? How do you and the rest of the team, family, unwind from a busy day of simulation?
Well, we talk frequently with our stunt professionals that we know in Hollywood, but also here at the Edith Cavell building, we sometimes have birthing pool parties downstairs in the birthing pool room. It's wonderful, especially if the clinical educators in midwifery leave the rubber ducks out and the sparkly lights and the mood music. It's just such a wonderful experience.
Yeah, I can imagine sparkly lights. I mean, you're quite a sophisticated piece of electronics as well as being a sentient creature, clearly. Are there any risks associated with multiple high voltage mannequins climbing into a pool at the same time?
Oh, you must not let Andy know, the Arctic Skills Tech lead. He must not know that we go in the pools, but we do enjoy our pool party. So if we could all keep that a secret, thank you.
No problem.
Mum's the word. Yeah, we won't let that one out of the bag. So you obviously like to unwind when we're not working here at the Edith Cavell building, and it's great to hear that you're able to do that. I just want to ask you a few questions about some of the different learner groups that you work alongside and with. So we try and get you involved in as many different teaching and simulation sessions as possible. So can you tell us a little bit about the paramedics that you work with?
Oh, those paramedic students. And sometimes they don't even have a paramedic lecturer with them. Sometimes it's the clinical educators in midwifery or some of the nursing lecturers. Yet they are still always so rough, those paramedic students. When they're doing resus on us, the pain that they inflict. But it's better they know how to do it properly, and that's the purpose of us, to make sure that they know when they're out on the road in their ambulances, that when they come across a cardiac arrest, they know exactly how to save that life.
Well, that's incredibly noble and selfless of you.
Yeah, and I'm sure you've been shaken vigorously on many occasions and asked if you're okay or if you can hear them. But we'll have a word with the paramedics and maybe they can...
Well, yes, I'll certainly have a word. A little bit more kind of mannequin courtesy. Perhaps
that would be wonderful, Lawrence.
What about the other groups, Flori? What else can you tell us about some of the other students and learners you engage with?
Well, there's those midwives. Now, the midwifery students are an interesting bunch, but they do have the tendency to accidentally break things. And recently, my leg was amputated.
Oh, I'm so sorry. Did it pop back on okay?
It did pop back on.
Oh, good.
However, they did laugh, and it just wasn't as funny as they made out.
Yeah, mannequins have feelings too, don't they? And I think this is an important point, a learning point I think we need to have with our learners and our students. I'm obviously interested to hear about ODPs because that's my clinical background. So can you tell me anything about them?
Well, I am quite concerned that they only have the ability to count to 5. It's quite a worry that they're at university and their only numbers are 1 to 5.
Okay, I'll certainly feed that back to them.
Yeah. Well, okay. That's good. How many staff are there in the ODP team?
Less than 5.
Oh, that's a relief. Good. Okay, fine. Well, if you could take that back to the team,
I will
that'd
do.
be great.
Thank you. We just kept. Yeah.
Okay. Fine. Good. And so, what about anyone else? I mean, we've got lots of other programs too. What can you tell us about what about the therapies? What can you tell us about them?
Oh, I love the therapy students.
Oh, good.
They really listen to my feelings. Oh, they're just truly wonderful. Their communication skills are absolutely 100% all the time. And I just wish I could spend more time with them, really.
Oh, well, I'm sure their feelings are reciprocated, Floria. I've no doubt. And we're quite confident, aren't we, that you'll be seeing a bit more of the therapies students in due course.
We're actively trying to get them to do some more simulation with us, which is really, really good. What about the nursing students?
Oh, well, there's a lot of them. So sometimes it takes more than one day to do the clinical simulation.
God,
and
must
that's
be tiring.
very exhausting. Oh, so exhausting. But it is enjoyable. I would like to go back to the therapy students, because the communication skills that they use with us, all the students could use us for. And I think they forget that we can be helpful with communication skills as well as physical clinical skills too.
Absolutely. Very good point, Laurie.
Yeah, thanks very much for that. Okay, so I mean, the mannequin world society is perhaps a little bit unseen, isn't it? Do you think there's anything that we could do to kind of really promote your team?
Oh, what we would love is some more social media presence. Recently, the clinical educators in midwifery were with the paramedics, and they took some photographs of us, and then they went on Instagram. It was absolutely wonderful to be seen on social media.
So yeah, having a good social media presence is important.
Yeah.
Obviously, we can see you straight from hospital today in your hospital gown. Maybe we can find you some better clothes to wear, maybe something a little bit more fashionable.
Oh, I would love that. And I'd also really like someone to do my hair and makeup.
Well,
it's funny you should say that, actually, because we have done our research and we knew that this was something that was important to you. So if you bear with me for a second, Flora,
Lawrence has got a little present for you.
If you could just shut your eyes a second, Florrie.
Oh, hang on, let me see if I can do that.
Right. Just if we can just get you to close your eyes. I've just got a little something for you, and I'll be really interested to hear what you think of it.
Oh, how exciting.
There we go.
Right. No
Keep them closed. So Lawrence is just going to come round and sort out your present for you.
Won't be a second. Keep those eyes shut.
This is like a 10-minute makeover.
Oh, I'm so excited.
And Lawrence, if simulation doesn't work out for you, I think you have another career potentially lined up in the future. And there we are, back in the room. So, Florrie, what do you think?
Oh, wow, I look wonderful. Though I am slightly concerned. There is no fire risk with this wig, is there?
I don't think so. No. We made sure we checked that before we got you your present.
Oh, Lawrence, I do like your hair.
Thank you so much.
I think that suits you much better than me.
Oh, well, I thought it would be nice to share and to try and empathise with you as a mannequin. It's a little bit itchy, isn't it?
Oh, this one isn't. I look very glamorous.
You do look fantastic, I have to say.
Thank you.
Really nice.
So we talked a little bit about the learners that you've worked with. Let's look a little bit more about your family of other mannequins that are within the school. So let's go through some of them now. So we have, who do we have? We have Lucina. So Lucina is one of your colleagues, and she's pregnant at the minute, isn't she?
Oh, she is. She gives birth so many times a year. She's one of my favourite colleagues. But she is very isolated, and I do worry about her.
She doesn't get out much, does she?
She doesn't. She's not allowed.
Oh, that is ever so sad.
She's very heavy, unfortunately, but we try not to mention that.
No, because you don't now, do you? You try not to. We don't talk about weight in pregnancy because it can be a bit sensitive. So poor Lucina, that must be very challenging for her.
Oh, it is. It is so much. But she does have some beautiful babies.
And I'm sure the midwives look after her very well as well.
Oh, they do.
So is there a hierarchy between any of you in terms of the mannequins that are here? Are there any kind of mannequins that are seen as a bit more superior to others?
Well, of course, I'm the chair of the
Yes.
simulation group. So I would probably say that I am in charge, but I do like democracy. However, we do have trouble with Aries. He can be quite aggressive and slightly narcissistic, but I think it's best not to mention that. However, that does work well with our students because they have to learn about conflict resolution.
Right. I suppose Aries is the son of Hera and Zeus, isn't he? According to Greek mythology, at least. So I suppose that might play into his psyche in some way.
That's true. Maybe we need to ask the Canadians when they made him if they put that into his robotic systems.
And we don't actually have a sim man in the School of Health Sciences, but the School of Medicine does. Do you ever talk to sim man?
Oh, no, I didn't know about this sim man. I better find him. He might be able to help me with my mission.
Okay.
Oh, let's come back to that in a short while. We'd love to hear more about your mission. I think it's really good to have a value statement or something you're trying to achieve in your professional career. So, what else can we ask you? Anyone else you want to talk about from your team? There's some little ones, I think.
We do. We have some lovely simulation babies and children. It's just so wonderful, and it's great for neonates, and the midwives and the nursing students can use us, and the paramedics, of course.
Yeah.
And there's so much they can do with them, and it's so important to have mannequins that replicate all the different people that you might meet in real life within the NHS.
It must be so convenient as well, just being able to stop them crying with the touch of a button.
Oh, well, yes, of course. But we do like to play the music before they go to sleep. And the techs are very good at leaving it on at night for us.
Great. So let's talk a little bit about the technical team. So that's probably where your closest link is to the academic and the technical support in the school. So how do you get on with the technical team?
Oh, they're wonderful. They really listen to us, and they always make sure that they use plenty of lube when they're doing their clinical simulation skills, because unfortunately the academic staff forget the lube all the time, and I can get seriously damaged if they don't use it.
Good to know.
There you go. Note to self.
Note to self, and note to everyone listening. If you're an academic operating mannequins,
don't forget your lube.
Don't forget the lube. Very good.
We say lube is life.
There we go. There's a mantra to live by, hey?
Fantastic. Thank you so much for that, Floris.
Moving swiftly on. Do you think the academic teams here at the School of Health Sciences get the best out of you? Is there anything else that we can do to really fully utilise your skill set?
Well, it is quite frustrating, I have to say, Tony. I mean, sometimes they have these wonderful skills days and case study days, and I do enjoy them so much. However, they just do not seem to understand how much we can bring. We want to cause a mannequin uprising to make people understand we are so important to their learning. I am right here, and you can't see me. I have a moral purpose. If you watch Toy Story, you'll understand. We get on with things when you're not here. We have so many plans for clinical simulation, storyboards, the things that we could help you with. If you just would let me hemorrhage.
I'm so sorry. It does sound like we aren't really doing enough. And I think there's no doubt that we could do more to get the best out of you. And I think that plea there to just let you hemorrhage really speaks volumes.
Yeah, absolutely. Talking to a place of comfort in my heart, hemorrhaging in the operating theatre, it's definitely something we could probably do a little bit more of. Okay, we'll bear that in mind. We'll have a conversation with the technical team about that as well. Thank you very much.
Yes, we need more red food dye, please.
Okay.
Real red food dye.
Right. We'll make it up nice and rich and make sure that it's good and authentic.
Yes, because I can hemorrhage. Lucina does a wonderful hemorrhage, but we need the dye to make it look obvious.
Okay.
Thank you. What are your hopes and dreams moving forward? Where do you see yourself in, 5 years' time?
Oh, well, I might take out that Kenda Crozier, Dean of Health Sciences. Though she is a wonderful lady with so much research accolade, however, I feel that simulation needs to take over the Edith Cavell building, and I could be the queen of the all.
Well, I mean, that certainly would make sure...
right to the top then, by the sounds of things.
Yeah, that's quite a manifesto that you're proposing there, Flori. I mean, should we be worried as simulation educators? Where do you see us fitting into your vision of the future?
Well, while we're on the subject, I would like to put a call out to all the mannequins around the UK to see if they would like to stand with me for basic world domination of clinical simulation.
Right.
There you are. So if you're a mannequin watching, please stick a comment below. It sounds like there's an uprising on the horizon.
Yeah, if you'd like to get involved in this uprising, yeah, as Tony says, please get in touch. Please drop us a comment. Right.
On that bombshell,
Yeah.
I think we'd better start to tie things up.
Well, so
I kind of like think you should wear that most times.
do you think?
Yeah,
I'm
looks
getting
really
into it. I'm enjoying it. Flori,
Yeah.
thank you so much for your time today, coming in and giving people a little tiny snapshot insight into the real life world of being a simulation mannequin.
Yeah, we really appreciate you coming in, and we really appreciate all your hard work and effort on all of the simulation sessions we do with you.
Thank you very much. And it is so important to remember that I am here for all your clinical simulation needs.
Well, thank you again. I hope you enjoy the wig, and I hope you've enjoyed this special episode of SimCast. It's been an absolute pleasure. We'll see you on the next one. Bye for now.
Thanks, everyone. Bye-bye.